given that this is something that we're seeing for the first time, David, can you tell us a little bit about the situation currently with monkeypox? Where does this outbreak look like in the non-endemic diseases, as John said, or non-endemic countries, as John said?
Sure, I'm happy to do that. So this has been moving fairly quickly. I mean, there are estimates that there are 50 to 60 laboratory confirmed cases per day in the last few weeks. And at this point, there are more than 900 cases, perhaps pushing 1,000. Many of these are laboratory confirmed. Most of them are relatively mild, which is good. I mean, if a small proportion have been hospitalized, but that's mainly for isolation purposes. There are many countries that have reported cases. Many of the cases where data are available are men. They're men between ages of 20 and 59. And many have presented to basically sexually transmitted infection clinics, to sexual health services. And a lot of this appears to be being driven by men who have sex with men, but also bisexual men, with relatively few cases in women. And the epidemiology is interesting. It turns out there are now 3 different large gatherings of men who have sex with men, MSMs. One in Antwerp associated with a fetish festival, one in Madrid, and then another on the Canary Islands, that appear to have served as amplifying and super spreading events. And almost none of these individuals have a history of travel to endemic areas in West Africa. The analysis of the strains suggests that they're really, maybe John can comment on this more, but they're really sort of 2 major sort of strains of the virus, or clades of the virus, and thus far everything points to this being the West African strain, which is found in Nigeria and some surrounding countries, which fortunately has a tendency to cause milder disease with a very low case fatality rate, as opposed to the Congo strain, which can be responsible for more severe disease.
Yeah, David, I think you mentioned the events that may have led to the spread of this disease among networks of MSM, of closely knit social networks, of which, this is in particular MSM. Can you clarify for us why this is? People hear this and they will think they are not at risk, if they're not part of this community. Can we stress about what we think this epidemiology applies and what it does not imply?
So there is a risk to basically anyone who has potential close contact with somebody who's infected. So all members of the population, of our global population, are at risk. It's basically having just close contact with somebody, especially close skin to skin contact, is going to lead to an infection. So this is not a disease that's isolated to one high risk population, but instead is something that almost anyone can capture.